Hello everyone, you're watching sqadia.com. And now we are on the Caisson's disease and Dysbaric osteonecrosis. Have you ever wondered that deep sea diving can cause avian of the family red? Yes, it can. In this topic, we'll be discussing what is the mechanism and consequences of deep sea divers, especially if they get Caisson disease, or the radiology and imaging if how the bone actually appears when the patient is suffering from this kind of a disease. What are its clinical features and what is the treatment which we can offer to these patients who have unfortunately suffer from severe nitrogen bends or Caisson disease, also called as dysbaric osteonecrosis. If you see, this is explaining it in very simple terms that this is a diagram over here. Blood is actually pumped by the heart towards the periphery, and from there it actually oxygen goes into the tissue cells, and then all the waste material, carbon dioxide, comes back via venous blood. Lymph comes back via the lymphatic systems. But what happens is, now this is at a normal atmospheric pressure. But if there is excess of an atmospheric pressure, which actually is in case when the workers are working in a deep sea area, and deep sea areas, there is excess, the normal nitrogen in our body actually saturates. They go into the adipose tissue and it gets deposited over there in the adipose tissue. And once the diver who is working under immense pressures in a special type of suit so that they can withstand that pressure, and the way like it's so many hundred feet below the sea level, once they start coming towards the surface, what actually happens is that this nitrogen, which has actually saturated in the adipose tissue, this becomes nitrogen oxide again and enters into the circulation. Once it enters into the circulation, where areas, especially when the small arteries are actually multiplying and dividing rapidly, and where there's a lot of kinks and turns of these arterioles, they get collected over there, and it's kind of an air embolic phenomena which occurs due to this collection of nitrogen. Now, this arterial gas embolism results in specific features of the disease called as the Caisson's disease. It is also called as decompression sickness. Why? Because air was compressed at a very high altitude when the diver was present deep down. Once it starts coming towards the surface, the pressure on the air actually decreases, leading to decompression of the pressure. This decompression sickness actually presents, especially for those divers when they are coming towards the surface very quickly. It's an important cause of disability in deep sea divers and compressed air workers building tunnels and underwater structures. What actually mechanism is increased air pressure. Blood and other tissues, especially fat, become supersaturated with nitrogen. Normally in inspired air, we know that it's almost 70% nitrogen. So that is what we're taking in as also some amount of nitrogen. But at this normal pressure, nothing happens because the normal atmospheric pressure is not high enough that it can cause saturation. But if atmospheric pressure increases quite a lot, for example, what actually happens when these deep sea divers are working those conditions in which there's high amount of atmospheric pressure, this nitrogen will once get supersaturated into fat. Once they get deposited, they can always enter back into circulation. If decompression is too rapid, gas is released as a bubble. Now you can understand that if there is saturated fatty tissues are laden with nitrogen, and suddenly the decompression has occurred and they're actually released as a bubble into the small venules, capillaries, and arterioles, where they're dividing and bending, and there's a lot of kinking over there. And these nitrogen bubbles can block those areas, leading to an air embolic phenomena. It's kind of an air going in and plugging the artery so that the blood cannot flow beyond that point. So what this results in, there's a local tissue damage due to infarction and ischemia. There is generalized embolic phenomena of intracapillary coagulation. Especially if this occurs in the bone, this results in swelling in the marrow and fat cells. And there is a decreased intramedullary blood flow, possibly due to oxygen toxicity. Now, if this is what is actually happening, bone is a part of the body, so it's, although all organs are affected, other viscera are also affected, but bones are especially affected, especially those arteries which are present around the joint. because around the joint, nature has actually given us a lot of anastomosis around the joint, because joints have to bend around and move. So when the joint, for example, if I'm flexing my knee or extending my knee, that flexion extension will not affect the blood flow which is going through the knee, because of very rich geniculate anastomosis around the knee. But this is an advantage at this level. But what actually happens is, because there is a lot of anastomosis and there's a lot of branches of one artery joining with another, what results is this provides a kind of a natural way where there's a lot of kinking and there's a lot of turning of arteries and small capillaries and veins with each other. And especially around the joint, once these nitrogen bubbles get deposited, this is kind of a juxta articular, or around the joint there's usually, especially the bones which is present around the joint. For example, if you take the example of knee joint, the most susceptible bone would be the distal femur and the proximal tibia, and that is where the most of the osteonecrosis occurs, which initially starts with swelling of the bone marrow and fat cells and eventually leads to decreased intramedullary blood flow, eventually leading to osteonecrosis or infarction of those areas. So what are the symptoms of decompression sickness? They include pain near joints. That's why it's called the bending decompression sickness, because normally the most susceptible areas are those areas where a lot of anastomosis, kinks of and turns of the arteries are present. Usually they are around the joint. Breathing difficulty and vertigo. Why? Because if they start blocking those arteries of the chest and especially of the respiratory systems, then they cause the breathing difficulty and vertigo and staggers. Circulatory and respiratory collapse can occur if the large artery is involved. For example, if a lot of nitrogen bubbles coalesce and block a very major vessel, this can even lead to respiratory or circulatory collapse. There may be several neurological changes, because brain is also a very fragile organ and contains a lot of small capillaries and arterioles and venules, and as they're kinked around, these nitrogen bubbles can cause microinfarct of the brain in different levels. And eventually, which may lead to, if there's a massive infarction or there's a massive area involved, which eventually may lead to coma or death. Now, coming to the radiology, usually X-rays are silent until unless, depending upon what kind of disease has occurred. If it's once in a blue moon occurrence, probably the X-rays will not show anything. But if that patient is kind of a who's an undersea worker who works in those undersea bridges and tunnels, then probably there will be some changes, especially the infarctions would be visible on the X-ray as well. Radiologically, bone lesions are found in only 17% of the compressed air workers. Almost half the lesions are juxta-articular, mainly the humeral head and the femoral head. Why? Because this is where around the joints the maximum anastomosis of the different arteries. They give off their branches, that is arterioles and capillaries. The capillaries connect with the venules. There's a lot of kinks and bends in turns, so that's why this is the area which is most susceptible. Microscopic bone death is much more widespread than X-rays suggest. And as you can appreciate, this is basically an MRI of cervical spine. This is the normal, but if you see it over here, there's edemation, and some degree of demyelination which is occurred in the cervical spine. X-rays may be totally normal, but the patient may be having neurological symptoms and a very severe degree of neurological symptom due to this edema of the cervical spine or spinal cord. This is an example of clinical and X-ray features. Many lesions remain silent. Medullary infarcts cause motile calcification or areas of dense sclerosis, which can be appreciated over here. These areas, this is motile sclerosis. Why? This is all dead bone. Due to multiple infarctions, this all area has become dead bone. Juxta-articular changes are similar to those other forms of osteonecrosis. And why? Because these are the areas that are most susceptible to nitrogen bubble air embolism. So coming to the management, the most important is actually to prevent them. That's it. We need rules. Although there has been actually a lot of rules have been formulated, especially in case of those who are working deep sea divers, especially those workers who are working at a very high pressures, especially way deep into the oceans and all that. But the most important is actually prevention. That is, bring those workers up slowly, then depressurize or decompress them slowly so that the nitrogen, which is already supersaturated, does not get converted into bubble and leading to air embolic phenomena, which eventually leads to Caisson disease. That is this, then the most important is strict enforcement suitable working schedules, that you cannot remain there for a longer period of time. There has to be a very strict amount of time they should be under those conditions at such a high pressure, and after that they should be brought to the surface slowly, and there should be proper check and balance for those workers, because otherwise their life would be at risk. Thank you very much. Keep watching sqadia.com.